Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and I am going to weigh in on the death of Katie May, the famous Playboy model who died recently at a very young age of 32, I believe, 34. And I want to convey my deepest condolences to the May family and all of her friends and fans, because dying at age 34 is tragic any way you die. Um, Now, we've been getting a lot of questions from patients, as well as seeing things on YouTube and the news, and a lot of you commenting on our YouTube videos about what I thought about the chiropractor being the cause of Katie May's death and the cause of her stroke. Um, I want to be very respectful in answering this question, because it is a person's life that we're talking about here, and that's all important at all times. But we're all walking around in gravity, sleeping in gravity, having accidents, which Katie May actually had a trauma a couple of days prior to her seeing the chiropractor during the photo shoot, is what all the news stories are saying. And there are a number of reasons for vertebral artery dissection, which is a tearing of the vertebral artery that goes up into the brain from the neck. And that could be caused by the trauma itself of the fall that she had, or the trauma to her neck that injured her neck in the first place, which made her go see the chiropractor. Strokes can just as easily happen while sitting in the dentist chair with your neck cranked back in a certain position over a period of time, or turning your neck to look at an oncoming car, sitting in a doctor's office, getting a arterial venipuncture, getting an arteriogram. These things can all be causes of a stroke, which is a loss of blood supply to parts of the brain. The brain dies, it doesn't have oxygen, has hypoxia, and the patient then dies. Chiropractic is very, very low on the list of causes of vertebral artery dissection. There has been a ongoing battle, if you will, from the medical associations and the doctors, MDs out there, against chiropractors for 100 years or more, stating that chiropractic was dangerous, and that chiropractors were the cause of strokes. Well, I did a lot of research on this before I decided to do this video, and some years back, the Journal of American Medical Association published a study indicating that in the hospital, taking the correct drug for the correct diagnosis in the correct dosage resulted in the death of 106,000 Americans per year, and the upper range of that was 137,000 deaths per year. And that's from taking the correct dosage of the correct medication administered in the correct way. These are considered non-error deaths, as drug diagnosis and dosage were all correct. The article notes that this number constitutes the 4 to 6 leading cause of death yearly in the U.S. Now that's a number of years ago. There's a recent study that was published by Johns Hopkins Medical School that stated unequivocally that medical mistakes were the third leading cause of death in the United States. And you can look that up anywhere you want to. That was done by Johns Hopkins Medical School, University. And then also the Journal of the American Medical Association article stated that 2,216,000 Americans suffer serious adverse reactions from correctly taken drugs in the hospital yearly but don't die. The author defined these as serious adverse drug reactions as one of the requirements of a hospital stay to recover, or an event that resulted in a lifelong disability. So that's 2,216,000 Americans suffering serious adverse reactions from taking drugs correctly. In comparison, chiropractic is exceedingly safe. There are about 70,000 practicing chiropractors in the United States today. Hundreds of thousands of neck adjustments done, which are different than just manipulations, which manipulations can be done by physical therapists, massage therapists. They're not supposed to be doing spine manipulations. However, that happens. Kung Fu masters, barbers, veterinarians, and other healthcare ancillary professionals. I'm just reading these notes because I don't want to make a mistake with this. The young lady, Katie May, who allegedly died from following a chiropractic adjustment, is problematic on multiple fronts. The press release on her death mentions two different arteries, the carotid artery and the vertebral artery. Chiropractic spinal adjusting has never been linked to injury to the carotid artery. So which artery was it that exploded? Here's a news report that's on YouTube.
The autopsy showed that social media sensation Katie May's death was caused by a neck adjustment. ABC's Marcy Cavacopoulos here with the story. Good morning, Mara.
George, good morning. Really troubling story here. May's career was just really taking off. In fact, she was on a photo shoot when she hurt her neck, and now we're learning treatment for that injury ended up costing her her life.
But how do we know it wasn't the injury that happened on the photo shoot? She didn't die in the chiropractor's office. She saw the chiropractor on a Friday and then went to the hospital in LA and died on a Monday. So who knows what happened between Friday and Monday as well.
This morning, new information about the sudden, shocking death of Playboy model and so-called queen of Snapchat, Katie May.
Hi, I'm Katie May.
The Los Angeles County Coroner's Office telling our affiliate KABC the 34-year-old mother's cause of death in February, neck manipulation by chiropractor. Now, her family speaking out for the first time about the tragic loss.
Your heart sinks because you feel like it was preventable.
My followers are why I'm here, so keep them coming, guys.
May had more than 2 million Instagram followers before her death and was very active on social media. A short time before her death, tweeting, "Pinched a nerve in my neck on a photo shoot and got adjusted this morning. It really hurts." Days later, tweeting, "It still hurts, going back to the chiropractor tomorrow." But officials say when May went back, the chiropractor tore one of her arteries during a neck manipulation, cutting off.
Okay, that's a problem. I don't know how the coroner can say that the chiropractor tore one of her arteries. Which one of her arteries, first of all, but tore one of her arteries, cutting off the blood flow to the brain. She got adjusted by the chiropractor on Friday. She doesn't go to the hospital and with the stroke until Monday. So, I mean, this coroner's report to me is really dubious in the fact that believe that he can say unequivocally, without a shadow of a doubt, that the chiropractic adjustment, which they're calling manipulation, which can be done by a hairdresser or a barber or a number of different types of professions that really aren't trained properly how to adjust the spine, can happen. Hairdressers, masseuses, kung fu instructors, untrained family members, people trying to help out, rubbing on their necks. But they're attributing it to chiropractic manipulation, when in fact it was not. Only one type of adjustment has the potential to injure the vertebral artery, that the trained licensed chiropractors are taught not to perform that maneuver. A lay manipulator is not trained and hence would be associated with increased risk of injury. So who did the manipulation in this case? I didn't hear the specific name of the chiropractor or exactly what type of an adjustment it was. Was it a chiropractor or was it an untrained layperson manipulating her neck? I was asked to address this by several people, and I'm trying to address it in the most respectful way that I can. And there is just,
Of blood flow to her brain. May died
in
a
my
few days
professional
later at the hospital,
opinion,
leaving behind her 7-year-old daughter.
with over 35 years of
By the time my
experience in
parents
adjusting
got to LA,
hundreds,
day, she was on life support.
tens of thousands of necks over
In
my
a statement,
35-year
the California
career,
Board of Chiropractic Examiners says it is
there has never
aware
been
of the
one
incident
patient
and is conducting an investigation.
have a stroke
adding
as
the
a result
doctor
of that.
has an active license and has no disciplinary actions against him.
It should make us all step back and ask questions to our doctors.
Yeah, these are the
What
medical
are the
doctors
risks
saying
to all
this.
the
Well,
procedures.
we should all
Now, we
step
did
back
try
and
to-
ask questions about the medications we take, the surgeries that we get. The third leading cause of death in this country is medical mistakes. So we should be asking questions. And as a chiropractor, you know, there is a risk of having a stroke anywhere by doing anything in any movement. So I do want to acknowledge that, and there is a risk of being injured that way through a chiropractic manipulation, but it is so rare that I find it very unnerving to hear all these news stations purporting that the chiropractor was the cause of her stroke and the adjustment was the cause of her stroke. And I don't see how the LA County coroner can, without a shadow of a doubt, unequivocally state that the chiropractic adjustment of Katie May's neck is the 100% cause of her stroke. So we'll finish this up and
Reached the doctor who treated May but did not get a response. Doctors tell us these kinds of accidents are very rare, but when they do happen, they can be very serious. As for May's daughter, who we saw in the
Well, of
piece,
course
her
it's
family
serious
has
when
set
you
up
have a
GoFundMe
stroke and
page
you
to help
die.
support
That's
her. She
very
was a single
serious.
mother, and now that child lost her mom.
And that's a very sad thing, and we do give our condolences to the family. And you know, it's very sad when anyone that age dies. We don't need to watch that one. There's other stories here though about it. That's not
When someone-
them.
Health alert. After a model died just days after visiting the
Okay,
chiropractor.
here's
Questo invece è un intervento da
that's
servizio
not it.
diretto su una
Health alert. After a model died just days after visiting the chiropractor. The autopsy showed that social media sensation Katie May's death was caused by a neck adjustment. ABC's Marcy Cavacampo is here with the story.
Okay, here's one from CBS News. I'm watching these on YouTube. You probably can see all these on YouTube for yourself. That's probably where a lot of you were getting these.
Dr. Tara Narula.
Hi, Josh.
Hi.
See,
so Tara,
chiropractor blamed for
first,
model's death.
dissection.
Corner,
vertebral
neck
dissection,
injury
exactly
caused
what
by
it is.
deadly
What is
stroke.
it, rather, that we're talking about?
So the arteries that supply blood to the brain, they can run in the neck, in the front, on the sides of the neck, and they can run in the back. of the neck. And those arteries, when they develop a tear in the lining, that can either narrow the lumen, or the tube, so to speak, of the artery, which could cause decreased blood flow to the brain and cause an ischemic stroke, or a blood clot can form on top of that tear and either break off and go to the brain, or again occlude that lumen or hole, and all of that can lead to an ischemic type of a stroke, which is the most common type of stroke. Now, dissections are more common in younger patients, those less than 45. They tend to be anywhere between 8 to 25% of ischemic strokes. But again, you
because
know,
they tend to be more active because they're more exposed.
I don't think we necessarily know the reason why they tend to be more common in the younger population.
We really know the
but
reason
usually
why.
The older population has ischemic strokes
She
that
had
are either
this
due to small
ischemic
vessel
stroke.
disease, microvascular disease.
I mean,
in the
it
brain,
could happen
or
from
embolic
turning your
events
neck too
from the
quickly
heart,
and
or
looking,
from
especially
plaque
after
in the
she's
aorta,
already had
or
an
plaque
injury.
in the vessels of the brain.
And so extreme force is the factor here.
Well, it doesn't take extreme
It doesn't
force.
take
So I guess
extreme force. This is
we're
an
talking about
empty
a
talk.
degree here.
I mean, that's a strong word.
Yeah.
And if you speak to neurologists, they will tell you that, you know, these types of dissections can happen with minimal type movements
Yeah,
of the neck.
moving your neck to look out the window
we
to
did a
see
story
if
last
cars
year that I told you
coming.
about a young woman who was playing tennis. And just from playing tennis, she ended up with a dissection. Things like golf, motor vehicle accidents, going to the hairdresser. These have all been case reports that have been associated with dissections.
So it's certainly possible that Katie could have just simply been more at risk than others, which
Very,
is to say,
very possible.
it would be certainly a rush to indict chiropractic medicine
Absolutely.
as opposed to seeing this perhaps as an individual patient.
Well, there are
who was
spontaneous
at greater
causes.
risk.
I could get
There
a
are
stroke from
spontaneous
cranking
causes
my
of
neck
artery
around trying to
dissection
look
that
at
have
this
nothing
while
to do
I'm
with
doing this
trauma.
YouTube video.
And in those patients, sometimes there is an underlying medical condition that predisposes them to it. There's something wrong with the connective tissues
That's
of the blood
very
vessels
correct.
at baseline, and they may be predisposed. But there are also traumatic causes. And you know, interestingly, this is a topic that was explored in 2014 by the American Heart Association and American Stroke Association, who published a scientific statement about this very thing, certain manipulation by chiropractor, and whether that can result in cervical artery dissections, meaning the arteries of the neck. And in fact, they said that there is a small association. Now, they can't prove causation, but there has been data to suggest an association with chiropractic manipulation and dissection.
And they could
So if
not
I'm a
prove
patient,
causation.
bottom line, and I want to go to a chiropractor,
Right.
what is it
Well, the important
that I
thing
should
is
be asking?
you should ask. First of all, the statement by the American Heart Association and Stroke Association said that chiropractors really should be informing patients about this potential risk, and that is, you know, an onus that's on the chiropractor. But certainly, stories like this, and any young person that has a stroke should raise awareness in people that these things can happen. While very rare and unusual, it is possible. So certainly, before you consider doing it, you want to think about it or speak to the chiropractor about it.
Certainly important. Dr. Karen Rolla, Doc, as always, we appreciate it.
Thank you.
And the other thing about this too is that, you know, there are inherent dangers of having blood clots in your legs, which is called thrombophlebitis, which a blood clot can occur in your legs, go up your legs into your heart, and cause a not an aneurysm, but a heart attack from an embolism is what it's called, an embolism, and that can also go up in through your carotid arteries, which are in the front, or your vertebral arteries, which are in the back, going up into your brain. That can also cause a stroke. So to say definitively that this chiropractor's adjustment caused this young model's stroke, I believe is not correct, and I believe it should be retracted, because there is absolutely no 100% definitive way that anyone can say that Katie May's stroke and death was caused by a chiropractic adjustment of the cervical spine. So this is your Houston chiropractor coming to you humbly regarding this subject from Houston, Texas at Advanced Chiropractic Relief, and we'll see y'all soon.